It's an extremely exciting time in this space, and it's an extremely exciting time for Allergan to be involved in this directly. I think I speak to most of you in the room here when we reflect back on just a few years ago where the energy and excitement was. It was not at its all-time high in the MIGS category and in glaucoma surgical procedures. And you look at where it's advanced from that time to where we are today, and I think we're at a real acceleration point for this part of the business. And I think it's a credit to the work that Chris and his team have done at LeCause, as well as Sean and his group and Dave and his team, and of course Ron Bach and the folks at Aquasys, to get us to a point where this MIGS space, I think, is really ready to explode. And I think it's because of the commitment that the groups have shown, but also the quality of data that's been generated, and frankly, just the economic market dynamics that are going to fuel the future in this category as well. So I'll talk a few minutes about what perspective is from a potential company acquiring a MIGS device. And I think when you're starting from a perspective where you have an established product portfolio and you have an established leadership presence in some certain disease area, you tend to gravitate towards other types of technology that can either add to that leadership or expand your leadership or add depth to capitalize on the investment you've already made in your infrastructure. And I think that speaks directly to one view that Allergan had taken in this particular space. So what we've got up here is just a quick chart just looking at dollar treatment share in the US market only in various therapeutic subcategories. And it can be categorized in a lot of different ways, but this just happens to cut it across these particular therapeutic categories. And you can see the two big ones are retina at the very top in the gray bar, as well as the red bar, which looks specifically at glaucoma. Very big categories, but glaucoma in particular in the US market has been a flat category for a number of years. And so it's a very attractive place to invest, but one which wasn't necessarily the most dynamic growth category. However, when we look forward and you start to anticipate what the future may look like, there are a lot of really attractive market dynamics that you would expect this category to continue to grow, right? It's a very prevalent disease. It's a disease that obviously will continue to see more and more patients get onto therapy as access to care continues to improve. We think the topical therapeutics will continue to be a major presence, but you have a heavy level of activity and investment in drug delivery and also surgical interventions that are now at a point where they are being taken more seriously and frankly offer a more attractive risk-benefit ratio as well. So the economics are much more attractive in the category. There's also a huge unmet need here, and you've heard it mentioned throughout the course of the day. The literature is riddled with the fact that we have a very prevalent disease with very poor patient compliance and adherence. And there are a few implications to that, right? One is not only the fact that you have care being compromised, but you also have a heavy cost burden on the system from patients who either aren't able to instill their medications consistently or frankly are unwilling to do so, and the cost that's incurred as a result of the wastage and the lack of undertreatment within this disease category as well. So when you look at what that unmet need has generated, it's generated an awful lot of activity, and we've seen that from all the projects that have been mentioned today and many others that maybe haven't been highlighted today around drug delivery and surgical interventions and other types of really novel approaches to try to address that non-compliance gap. And so when you look at the market going forward, we would expect topical therapy to still be a mainstay of glaucoma therapy. But we can debate what the size of the slices of the pie may look like. We also think that we're going to see rapid acceleration in growth in those other types of non-topical therapeutics, such as the MIGS category, probably the one that we believe will lead that area. I don't know if there's a way to advance this next slide. It doesn't seem to be clicking here for me. There we go. So just a couple of quick comments on some learnings as we've gone through this journey from an acquiring company, right? The illustration here on the left side of the chart, there are multiple varieties of this, and I heard it mentioned even in Bill's talk this morning. This is an iterative process. It's one that can take a varying amount of time. In some cases, it can be a matter of months. In other cases, it can be many, many years. And I think in this particular area, we have seen this iterative process really play out in a textbook manner. There have been various modifications to these devices. There have been various improvements in clinical study design, better quality data, And as a result, you've seen now multiple entries into a category that just a few short years ago was really just in its infancy. And I think the exciting part about that is the bar should go up at this point in terms of what expectations should be in terms of the quality outcomes that we can expect in this area. We should expect more in terms of an efficacy improvement. We should expect more in terms of more consistent, prolonged effect, as well as attractive economics in this category going forward as well. So as we continue to look at the future, Allergan is extremely excited to be part of this space, but would also encourage us all to continue to think big and look at paradigm-changing technologies such as this, because I think they benefit all involved. Thank you very much.